Good morning to everyone, to Pepe Mejia, who joins us for the first time today, to our sign language interpreter, and good morning to everyone tuned in to this briefing. Today is a bad day, with negative results. We start today's briefing by offering our condolences following the death yesterday of 2 people diagnosed with COVID-19 in our country. The first was a 74-year-old female patient from the province of Ciego de Ávila, who was suffering from some pre-existing medical conditions. She was admitted to hospital on August 29th in Ciego de Ávila, then transferred to the military hospital in Camagüey after testing positive for COVID-19. After 14 days in hospital, she suffered a series of complications which began to intensify in the early hours of September the 11th, and despite our efforts, the patient could not be revived. We offer our condolences to her family and friends. The other patient was a 91-year-old man from Havana, also suffering from pre-existing medical conditions. He was admitted to hospital on August 20th after being identified as a confirmed case contact. He tested positive for COVID-19 and was transferred to intensive care after his condition began to deteriorate. He suffered a series of complications and yesterday afternoon, and despite the best efforts of our medical personnel, could not be revived. Again, we offer our condolences to the family and friends of the deceased. Today, 1,585 people are hospitalized in Cuba. 61 are under observation. There are 859 suspected cases and 665 confirmed active cases. Yesterday, for the first time, we processed over 8,000 samples, 8,128, in our various molecular biology laboratories. 2,420 of the samples were processed at the Pedro Curi Tropical Medicine Institute, 1,081 in Villa Clara's Hygiene, Epidemiology and Microbiology Center, 903 in Havana's, 278 in Santiago de Cuba's, 564 in the Genetic Engineering and Biotechnology Center Lab, 549 in the Naval Hospital, 474 in the Fructuoso Rodriguez Hospital Laboratory, 461 in the Hermanos Almaheires Hospital, 458 in the Molecular Immunology Center, 422 in the Manuel Fajardo Hospital Lab, 323 in the Civil Defense Laboratories, and 195 in the National Center for Genetics. Of the 8,128 samples processed, 60 tested positive for COVID-19. That's 60 people. This brings the total number of samples processed in the entire country since the pandemic began to 477,559, of which 4,653 people have tested positive for the virus. As I always mention, samples from all of the country's provinces and the Isle of Youth Special Municipality were tested. 174 from Artemisa, 4,713 from Havana, 179 from Mayabeque, 368 from Matanzas, 237 from Cienfuegos, 178 from Villa Clara, 1,774 from Ciego de Ávila, 160 from Camagüey, 82 from Las Tunas, and so on and so forth from all of the country's territories. All of the 60 positive cases diagnosed yesterday are Cubans, 4 of which are imported. 44 or 73.3% of the 60 positive cases are confirmed case contacts. This means that 4,145 people, or 89.1% of all diagnosed cases in Cuba, had contact with someone who had previously tested positive for the virus. This is the highest risk group, which is why all those who have had contact with a confirmed case are immediately traced and isolated. Of the 60 cases diagnosed yesterday, the source of infection linked to 12 is yet to be determined. This means that the source of infection in 75 cases reported over the last 15 days is still being investigated. Yesterday, 4 people to have tested positive for the virus contracted it abroad, meaning that imported cases stand at 433. Of the 60 diagnosed cases yesterday, 20 are male for 49.8% of all cases, and 40 are female, representing 50.2% of all diagnosed cases since the pandemic began. As we can see, females now surpass males in regards to confirmed cases. 29 or 48.3% of the 60 cases yesterday were asymptomatic at the time of testing. Overall, 58.6% of all positive cases on the island since the pandemic began have shown no symptoms at the time of testing, and this figure rises to 60.3% over the last 15 days. By age group, 4 positive cases diagnosed yesterday are under the age of 20. 25 are between 20 and 39 years of age. 29 cases are between 40 and 59. And 2 are over the age of 60. Of the 60 cases diagnosed yesterday, 28 belong to Ciego de Ávila, 21 to Havana, 3 to Artemisa, 2 each from Matanzas, Granma, and Santiago de Cuba, and 1 case from Mayabeque and another from Holguín. Of the 4 imported cases, 2 belong to Granma and the municipality of Manzanillo, while the other 2 belong to Santiago de Cuba and the municipalities of Santiago de Cuba and Contramaestra. None of these cases have anything to do with their provinces of residence, where no new cases have been reported for several months. Of the 56 autochthonous cases, 28 belong to Ciego de Ávila and the municipalities of Ciego de Ávila with 21, Bolivia with 1 case, Paraguay 2, Majagua 2, and Venezuela with 2 cases. The 21 cases from Havana belong to the municipalities of Cotorro with 4, Arroyo Naranjo with 3, Guanabacoa with 3, Regla 2, Centro Habana 2, Habana Vieja 2, Habana del Este 1, and 1 case each from San Miguel, Marianao, La Lisa, and Cerro. The 3 cases from Artemisa belong to the municipalities of San Cristobal, with 1 case, Candelaria, 1, and 1 from San Antonio de los Baños. The 2 cases from Matanzas belong to the municipalities of Matanzas, with 1 case, and another from Unión de Reyes. The case diagnosed in Mayabeque is from the municipality of Nueva Paz, and the case from Holguín is from the municipality of the same name. Yesterday's results therefore mean that Ciego de Ávila has the highest confirmed case rate per 100,000 inhabitants over the last 15 days, with 36.38. Havana follows with a rate of 21.36, slightly lower than yesterday. Artemisa's rate rises slightly to 13.98, as does Matanzas with 3.75. Mayabeque follows with 2.08, then Pinar del Rio with 1.37, Sancti Spiritus with 1.72, Cienfuegos with 0.49, and Las Tunas with 0.19. This means that Cuba's rate also rises slightly to 6.62 per 100,000 inhabitants over the last 15 days. To summarize, of the 4,653 people who have been diagnosed with the virus thus far in Cuba, 665, or 14.3%, are active hospitalized cases. 644, or 96.8%, are clinically stable. Yesterday, like I mentioned, 2 COVID-19 related deaths occurred in the country, meaning that the COVID-19 death toll on the island rises to 108, with a mortality rate of 2.32%, lower than the global rate of 3.22% and regional rate, which stands at 3.46%. As I always mention, 2 people were evacuated at the start of the pandemic. Yesterday, 34 people were discharged from hospital, an acceptable result. 21 people were discharged in Havana, 4 in Artemisa, 4 in Pinar del Rio, 4 in Las Tunas, and 1 in Camagüey. This means that, to date, 3,878 people, or 83.4% of all confirmed cases in Cuba, have recovered from the virus. Today, 6 patients continue to be in a critical state, 1 in Havana, another in Ciego de Ávila, and 4 in Camagüey. 15 patients are also reported as serious and are being treated in different medical institutions around the country, 9 in Havana and 3 in Camagüey's military hospital. This is the situation in Cuba. Now we are going to turn our attention to the world. As of yesterday, COVID-19 continues to be present in the same 185 countries. Yesterday, 308,462 people were diagnosed with the virus, for a total of 28,199,791 confirmed cases since the start of the pandemic. Yesterday, 6,087 people died of the virus, for a total of 910,078 COVID-19 fatalities and a mortality rate of 3.22%. The region of the Americas, which accounts for 51.75% of all cases worldwide and continues to be the epicenter of the pandemic, reported 121,221 new cases yesterday, for a total of 14,594,938 people to have been diagnosed with the virus. Meanwhile, over half of deaths reported yesterday occurred in the region. 3,403 people died of the virus in the Americas yesterday, for a regional death toll of 505,897 and a mortality rate of 3.47%. The United States continues to top the list of countries worst affected by the pandemic, with 6,397,227 confirmed cases and 191,789 COVID-19 fatalities. India follows with 4,562,414 cases and 76,271 fatalities. Then Brazil with 4,238,446 confirmed cases and 129,522 deaths. Russia comes in fourth place with 1,046,370 cases and 18,263 COVID-19 related deaths. Yesterday, 974 people died of the virus in the United States, 1,209 in India, 983 in Brazil, and 270 in Russia. From our region, Peru follows Russia. Then comes Colombia, Mexico, Argentina, Chile, Canada, Bolivia, Ecuador, and Cuba in 21st place in the region. This is the information that we have on the behavior of the pandemic in Cuba and the world.